Hey, everybody, good morning. It's Dr. Levi with your show, The Dr. Levi Show. Today is October 19th, 2016. Beautiful here in Los Angeles, as per usual. I hope wherever you are today, you're making it a great day. And I want to remind you that you are worthy just because you're here. No one needs to validate you. No one needs to say that you're good. Tell yourself you're good. Love yourself. Give yourself a hug. Give yourself a gift. Don't wait for someone to send you flowers or chocolate. Go and buy your own flowers. Go and buy your own chocolate. Kiss and love yourself. Why not? Life is good and life is for you. I want to remind you that the universe is conspiring for your greater good. All the challenges, all the good, all the bad, guess what? In the end, it all makes us better people. In the end, it all makes us more of who we really need to be. And it's through the challenges that we become better people. So again, don't run from the challenges. Don't run from the pain. Run right through it. That's the key. And know that you're worthy and that you can get through any hurdle in your life. Why? Because you matter. Your life is important. Your life is important for the greater good. So we have a great show for you today, lots to talk about. This is our Q&A day. So a lot of questions from the gaming community, a lot of questions from YouTube, from Twitch TV, just a lot to talk about today. So get ready for an action-packed hour. Speaking of action-packed, this weekend was the phenomenal Action Icon Awards. It was really just spectacular. That's all I can say. You know, Levi Baker, she is one of America's first stunt women, and she did an incredible job this weekend. You know, her foundation, the Diamond in the Raw, is really about reminding us that you're just as important in front of the camera as you are behind the camera. And what she does, the Diamond in the Raw Foundation, about empowering young women, especially young women of color, to understand that their presence in front and behind the camera is important, and to give them insights about what they can do as a producer, as a director, not simply as the actor or actress, but things that go on behind the camera. So I want to thank Levi Baker. I had an opportunity to present it was called the Award of Difference, and I gave that to my friend Jen Bricker. And Jen Bricker is this extraordinary woman who is the sister of Olympic gold medalist Dominic Marciano. And Jen, unlike her sister, was born without any legs. However, that's never impeded her from doing what she loves best, which is to perform and to be the aerialist that she is. She's a world-class gymnast. She's really just a phenomenal woman. So Jen Bricker, shout out to you. You know, I love and appreciate you. And it was the highest honor for me to give her that award. It was really odd because no one on the panel, even though I'm on the board of trustees for the Action Icon Awards, no one knew that she and I were even friends. So to give her that award was even more meaningful for me as well as for her. So I want to thank Levi Baker for that. The Action Icon Awards, it was held at the Sheraton at Universal Studios. It was just a great, great event. Had a chance to meet Charlie Sheen, had a chance to talk to Patrick, I can't think of Patrick's last name, it'll come to me. But it was just a great, great environment there. We also saw Nina from Access Hollywood. She was there as the host. She did a phenomenal job, too. It was really just great. Also, Carol Rodriguez, Olympic medalist and track star. She was amazing also, and she and I presented together. So, Action Icon Awards, Levi Baker, great, great job. Now, I want to thank everyone for subscribing and following us on all of our YouTube channels, Instagram, as well as Twitch TV. You know, Twitch TV will be coming up again. It's the first Saturday of every month. And again, it's an opportunity for me to interact with the gaming community, as well as anyone else who has a health question, any issue that you have. Myself, as a physician, as a surgeon, as a talk show guy, my job is to help you. My job is to be of service to you. So tune in to Twitch TV. I mean, it's very interactive. It gives me a chance to really see what's really on your mind and then to tell you how I can help you. And the bottom line is this. Even though I'm taking your questions, it's also imperative that you see your doctor or healthcare practitioner in your own community. You have to do that because don't forget, I'm not examining you. I'm just reading your questions or what you think's important, but it's important for you to be seen and evaluated by another physician or healthcare practitioner in your community. That's important, all right? So I want to go over a few things. So again, Action Icon Awards, amazing this past weekend. And, you know, CNN, the piece I did with CNN with Dr. Sanjay Gupta goes live today. It's really amazing. So that's entitled, It's CNN International and CNN Today with Dr. Sanjay Gupta. It's on video games and myself as a video game player, as well as someone who takes care of gamers from all over the world, from as far away as Australia to Canada to the UK to the US, of course, to Korea. I mean, my job is really intense, but I'm grateful for it. I'm grateful to be very busy. I always tell myself the opposite of busy is not good. So I'm grateful to be very busy. I'm grateful to be able to help people and to use this platform that I have with my team to do good and to really help humanity. So I just want to give a shout out to Dr. Sanjay Gupta. I want to thank him and Ben for having us on the show, and I can't wait to actually see the show myself. So thanks a lot. Then November 4th and 5th, BlizzCon, going up to Northern California for that. Really elated. My team and I, Janet and Aaron, will be headed up there, so that'll be a great, great event. Really a phenomenal time to actually not only interact with the gamers, but actually do some video gaming myself. So, and as I've said before, what I love about video games and esports athletes is the fact that they are so committed to their sport. They're so committed to being the best, increasing their actions per minute, for being the best in the first-person shooter game even. I just love interacting with them. So BlizzCon, November 4th and 5th in Northern California. Now, Twitch TV, of course, on November 5th at 7 p.m. I'm looking forward to having you guys interact with that. And that's 7 p.m. Pacific Standard Time. And, of course, Adelante Youth Conference. That will be absolutely amazing. That's coming up, of course, on I want to give you 2 dates here. It's at Pasadena City College, November 12th. And Adelante Youth Conference is going to be with over 1,000 youth that I have a chance to talk with and really get to motivate them about maybe considering healthcare as a future, as a vocation, as a way of being of service. And the great thing about medicine and healthcare in general, there's so many fields. There's occupational medicine, there's occupational therapy, there's physical therapy, there's medicine, there's internal medicine. There's so much. So that's going to be on November 12th at Pasadena City College. And if you want a child to be motivated, come and see us talk. It'll be myself and several other speakers. And really the goal for that is to remind people that no matter where you're from, that doesn't define who you are. Myself coming from New Orleans, Louisiana, as a kid coming from a home that was infested with roaches and rats and all kind of horribleness, I was thinking the other day, I want to share a quick story with you. I was thinking the other day, I was talking to my sister about 2 weeks ago, and we were laughing about some things. And right after I got off the phone with her, the last thing she said to me made me think about a house that we lived in that had rats that were as big as cats. And I remember as a kid, my sister's bed was right next to my bed. My sister never knew this, but I would stay up at night. I wouldn't sleep to make sure that the rats that I would hear and see running around the room wouldn't jump into her bed and scare her or bite her even. So we lived there for about 9 months. I think I slept maybe 9 hours in 9 months because my goal was to protect my sister, to make sure that the rats, and they would jump right in bed. They were huge enough, and they were fearless. They'd get right in bed with you and look at you like, okay, can I sleep over here? It's like, no, you cannot. So I share that story because, as a physician now, and I'm grateful, thank God, as a successful physician who can really use my platform to give more and to be of greater service and to volunteer more. My goal with the Adelante Youth Conference is to really remind people that your past and where you're from and what was done to you as a child does not stop you from reaching the highest levels of your life. So the stratosphere is actually waiting for you. You simply have to do the work. You simply have to have a dream. So it starts like this. First, you have the thought. Then you have a dream about it. And then you write down what your goals are. Then you do the work, and then you enjoy the creation of it. It's really like that. As you create your life, as you manifest goodness in your life, it's really about doing the work. But you have to do the work. It's sort of like you hear people say this old adage of someone saying, well, I didn't win the lottery. And then someone tells them, well, you didn't buy a ticket. Well, life is like that too. Unless you want to get somewhere and have a goal, have a dream, and do the work, you're not going to get there. So you have to have the thoughts and the dream. You do the work, and then you make it happen. And never take no for an answer. Never let someone tell you that, like I used to hear as a kid that I was too black to ever be anything. I was told that very often by my teachers that I was too black to ever be a success, that I was too black and too short to ever do anything, that I looked so odd that I could never do any. I heard that over and over. When people would tell me that in my mind, I would think, okay, whatever you say, whatever works for you. But it never affected me. It was like ice. I just let it like fall off. It never bothered me. I never thought about um, my skin tone as being a reflection of the success that I can have in my life, because I define my life. I define who I am, what I am, where I want to go, what I want to achieve. So I want to remind you all out there today, our audience, the Dr. Levi audience, our community, that I want you to strive to be the best that you can be. I want you to work hard. I want you to be an advocate as well as an activist in your community. When you see injustice going on, do something about it. If you see bullying going on, do something about it. We say in medicine there are 3 types of bullying. There's the bully, there's the person that is bullied, and then there's the bystander. So the goal is to not be in that at all. If you see something happen, report it. If you're the bully, stop it. If you're being bullied, don't tolerate it. Let people know so that things can happen, so that can be transitioned, so you're not being bullied. The goal here is really simple. We do this show because we want you to have a phenomenal life. We want you to know that you are worthy. We want you to know that the universe is conspiring for your greater good, and that anything you can imagine, you can achieve it. That's anything. You're only limited by your imagination. So I want to remind you to dream big, to believe in yourself, to know that you matter. Don't worry about what has happened in the past, from the molestation to the beatings to the alcoholism. I came from a family with a lot of uncles. As I said before, I called them drunkles because they were drunk most of the time. I had a dad who was a wife beater, a drug addict, an alcoholic. But you know what? All of that was their issue. It doesn't define me. So I want to remind you that you're not defined by your past. You're not defined even by your parents. You're really not. You're a self-contained, self-standing human being who has the capability and the potential to make the world an even better place. That's the goal. How can you make the world a better place? Think about it. We're waiting for you. Now, I also want to tell you about a few other things that are going on so that we can all be on the same level here. So ESL, we have the ESL finals in Northern California. That's going to be November 19th and 20th. I will definitely be there also, so gamers get ready. And, we've been doing the Dr. Levi Insta Tips. You guys have been enjoying that. I enjoy doing them. And that's only on Instagram, so there's a new video there once a week, so please enjoy that. And then I want to just remind and thank everyone for liking us, following, subscribing on all our social media platforms. Again, Instagram, Facebook, Twitter, going to our YouTube channel. We just appreciate you very much. I'm so grateful now that our following continues to grow. Our subscriber numbers continue to elevate. So all is good. So as my life continues to unfold with greater goodness, I want your life to unfold with the same. Goodness, health, happiness, truth, authenticity, gratitude, magnanimousness, splendiferousness. I want you to feel good about everything, because I wake up every day feeling good. I want you to do the same thing. Why? Because every day is a gift. Why? Because you take yourself wherever you go. That's the bottom line. So take a happy, prosperous, healthy self, and then be mindful of your friends. If you're around a lot of people, think about this. A lot of people are always complaining, always bitching, moaning, and groaning. You want to ask yourself, you know what? Why do I want to be around you if I don't want to be like you? If you're around a lot of people, it's kind of like vitamin to Vegemite. That's what I sound like right now. If you're around a lot of people who don't like life, well, you know what? Step away from them. If you're around a lot of negativity, say, time out. I don't want to do that. If you're around people who are always like moaning and groaning about not having enough money, their money is funny and their change is strange, I can't do this, Levi, I can't do that. You know what? Get some new friends. You know what? Do what I do. I do a lot of this. I be by myself. I just love me. I love me so much. I hope you do the same, But don't settle for mediocrity in your life. There's no room for that. Our lives are about excellence. Our lives are about perfection. Our lives are about divine service, giving back. Because don't forget, you only get what you're willing to give away. So if you don't have any money, are you giving money away? If you don't have any goodness in your life, are you being good to people? If people are not forgiving you, are you forgiving other people? Think about that. It's so very, very important. Now, you ready for the Q&A? Let's get started. Okay, the first question is from YouTube. This is from Twitch TV from the video that we did there. And this is from Lipinski Jakub, Jakub. And the question is the following. Also, I would love to ask, why does my wrist crack every time I do the out at 11 o'clock? Should I be worried? So what Jakub is asking is, there's an exercise that I have on YouTube where your wrists are like this. Out, back like that. And so the question is at 11, when she's in the 11 o'clock position, that she hears cracking, that he or she hears cracking. So let's talk about that. Again, when you hear cracking in your wrists, for example, cracking your fingers, which I love doing, that means there are nitrogen bubbles that are in the joint that are basically imploding or just being pushed aside and bursting. So cracking your joints does not mean, so often, that you used to hear people say that, well, if you crack your joints, you're going to get arthritis. That's not true at all. There are no double-blind studies that say that at all. So if you're cracking your fingers, like I'm doing right now, that simply means that you have nitrogen in your joints, in the joint fluid, in the synovial fluid. It doesn't mean anything bad at all. So Lipinski Jakub, no worries there. I hope that helps you. Now, the next one is from Reason Over Dogma. The question is, and comment is, great video. I've been having injuries with my wrist. The stretches are a good recommendation. I'm going to try that before I play. Okay, well, Reason Over Dogma, I think it's a great idea. If you do the stretches, but more importantly, don't forget, you want to take the 5-minute break every hour while you're gaming. The issue with gaming is RSI, repetitive stress injury. So myself, as a physician, as a surgeon, and as a gamer, it's so important that you take the 5-minute break every hour and also do the stretches and do different stretches every hour, not the same ones. It's like working out. If you want your body to change when you're working out, then do something different. If you go to the gym every day and only do the Stairmaster, well, you don't allow other muscles to be recruited to get stronger and to be more flexible and increase your endurance with your muscularity. So with that said, it's so important that you do the stretches, but also take the 5-minute break every hour. All right, next question is from Thomas Says Stuff. So it says, thank you so much for your videos and help. I suffer from arthritis in my left wrist as a result of gaming since I was a child. Your videos have helped me prevent further damage. Okay, well, Thomas Says Stuff, thank you very much for that. The goal with the videos, Thomas, is the following. Thomas Says Stuff. So the goals are the following. One, to keep you healthy, preventing injury, and to get you stronger, and more importantly, to allow you to game for a prolonged period of time without getting injured, and to increase your actions per minute, and to give you greater success while you're gaming. That's my goal. Real plain, real simple. That's it. So thank you very much. Thomas Says Stuff. The next one is from Snake2250, 2250. So after watching this, I raised my chair up and my main monitor to eye level. I've never had any problems when playing for long hours after almost 18 years of gaming until I started playing OSU. I'll be sure to come back and tell you if it gets better or goes away with this new setup, as long as I'm using your stretches. Okay, well, Snake 2250, thanks a lot. I'm glad you're using the stretches. Yes, it's so important that you do the best that you can to ergonomically balance your keyboard. And remember, when you're at a desk, any desk, make sure that your back is straight, that your shoulders are square, that your head is up. Make sure you're not rounding your back, not slouching over. Those positions of comfort, they're just that, positions of comfort, but they're not positions of function, and they're not positions of kinematic balance. So my goal here is to remind you to keep your body in the most kinematically balanced position. It's about reminding you that you want to take the stretches while you're playing any game, where the monitor should be, where the keyboard should be. We have all those videos on YouTube about this. All my blogs have the articles I've written about monitor placement, about keyboard placement, about mouse placement, about the proper mouse, about monitor height, about eye level to monitor. Everything is there. So I'm glad this is helping you, Snake 2250. All right, next question is from Tune Edits. That's TUNEEDITS. Keep it up. I had hand problems from gaming too much after doing your exercises. I haven't had any problems. Really helped me a lot. Okay, well, Tune In Edits, I'm really happy to hear that. Just remember, the exercises are kind of like fitness in your life. Fitness is non-negotiable. We have to work out. Even if we're tired, we don't feel like it. You had a long day, stressful day, you have kids, you have a job, you have crazy neighbors. We all have that stuff. You know what? But working out, we have to do that. Working out has to be as important as breathing, drinking, eating food, drinking water. It's just that important. We have to work out. Now, the bottom line here is since you're doing the stretches, great, but the key is like fitness, commitment and consistency. You want to be consistent. So not every other day, not once a week, but every day take time to honor your body and to do the stretches and do the things that will really help you. The goal here is the following: helping you to elevate your game, helping you to do what I always say at the end of most of my comments, game on. I want you to be able to game properly without being injured. That's the bottom line. All right, so I hope, thanks a lot, Tune Edits. The next one is from, I love this, Happy Love. That's nice. HAPPYLUV. So Happy Love says, love the channel. Any questions on helping me recover from my sprained ankle from soccer? Is there such a thing as a fast recovery? Okay, Happy Love, great question. You know, I take care of a lot of athletes and a lot of stunt people in my practice here in Los Angeles. So let me talk about ankle fractures and ankle sprains and strains. So they're some of the most common injuries that I see in my practice. As an orthopedic surgeon, but my specialty is hand, wrist, elbow, and shoulder, but I still take care of people's bodies from head to toe. So the bottom line is this: ankle fractures or ankle sprains. Well, you actually asked about an ankle sprain, so let's go over that for soccer. The most important thing is to rest it, to ice it. You know, we talk about rest, ice, compression, elevation, the Rice method. That really applies to an acute injury. When something first happens, these are things you want to do. You want to elevate it, ice it, put some mild compression, and of course, rest it. Now, if you've done that, then the next thing, of course, would be to start some anti-inflammatory medications if you have them. Or you could go the holistic route, too, and drink ginger tea and things like that, which we know will decrease inflammation globally in the body. Now, the other thing that I like with respect to treating ankle sprains, and this is controversial, but I'm controversial. I don't care about that, is acupuncture. I love acupuncture because acupuncture is a very underappreciated modality of healing for the body. So I recommend that you try some acupuncture also, and then make sure that your doctor who's ever seeing you, that they're wrapping your ankle properly. There's a certain type of way that we wrap the ankle with tape. We can tape the ankle properly so that you can walk, or hopefully you have it's called an air cast or air compression boot that we'll use if someone has a really significant ankle fracture, or ankle sprain, I should say. So I hope that helps you. So number one, you know, when we talk about fast recovery, your body's going to do what your body does. So your body's going to heal differently from my body or from Tony's body or Jarvis's body or Janet's body. That, you know, our bodies heal differently. Our bodies heal depending on several things. One, do we have any chronic illnesses or injuries there? Two, what about your nutrition? Is your nutrition up to par? Three, are you resting the area of interest? And four, are you still working out? So I want to remind you, even though you have an ankle sprain, so often with athletes, especially some of the professional athletes, I have to remind them that when you have an injury, having an injury doesn't mean that, okay, I can do what I want, I can stop working out, I can eat whatever I want. Just the opposite. When you have an injury, you work around the injury. So if you have an ankle injury, well, you still work your core, you work your abdominal muscles, you work your upper body, you do your back. You know, having an ankle sprain, well, yes, you can't run right now, you can't jump, you can't do any plyometrics, no problem, got it. However, the rest of your body is still intact, you still do your exercise. And the other thing that's so important, this is 85% of it, I always say, your diet. You have to watch your diet. One thing about our bodies reflect what we do to them. So if you eat healthy, you look healthy. If you eat whatever you want, you look like you eat whatever you want. You know, if you're working out, you look like you work out. If you don't work out, you look like you don't work out. You know, there really aren't a lot of, there's not a lot of duplicity or a lot of gray zone about working out. If you do it, your body looks like you do it. If you don't, then your body looks like you don't. And the bottom line is you're not doing it to have your body simply look a certain way. You want to be fit to stave off heart disease, stroke, diabetes, congestive heart failure, different forms of cancer. You want to do it for that. Because if you don't have those things, and the great thing is what? You can be of greater service to the community, greater service to humanity. we're not simply being fit to be a self-contained entity. No, that's not enough at all. You want to be fit so you can give more to your community. That's the bottom line. All right. So again, with an ankle injury, work around the injury. There's no really fast recovery. The fast recovery is your body taking time to rest and heal properly. But I do recommend the tape. Taping is very, very important. Use the tape for your ankle. All right. And that question again was from the name that I love, that handle of Happy Love, LUV. All right, the next one is from Inquisitive M. So the question is, I had trigger finger several months ago, and my finger still feels sore, and the scar tissue still stiffens when I wake up in the morning, though no locking has occurred since the surgery. There's still soreness or pain if I press on the area. Is that normal? Also, it seems to me that trigger finger surgery does nothing to reduce the inflammation. All it does is release the pulley. Okay, and that's from Inquisitive M. So I really thank you for that question. So several things about trigger finger. It's one of the most common surgeries I do every week, at least 5 to 7 of those per week. So let me tell you about that. Again, yes, trigger finger, someone's finger stays down like this. And that's because there is stenosis here at the A1 pulley. So the flexor tendons, the FDS tendon, flexor digitorum superficialis, and flexor digitorum profundus tendons are both trapped at the A1 pulley, the annular pulley, right in this area at the MCP head. So what we do is we make either a transverse or a longitudinal or horizontal incision over this area. And as we go down, we release the pulley and we close up everything. Now, what I found to be most important is starting physical therapy early. When I say early, within 3 to 4 days after surgery. And also to remind the patient to keep moving your fingers after surgery. So often people will have the surgeon, their doctor, he or she will tell the patient don't move your fingers for a week or two until I see you back. Well, think about it. Anything that you don't move gets stiff. Anything that you don't move stays in that position just like it is. So you want to move the finger. Now, the other thing that's really important is that after the sutures come out in 10 to 14 days, that you start very aggressive. Keyword here, this is the caveat with trigger finger, aggressive scar massage and desensitization. Now, how do you do that? Well, I want to show you. I want to show you 4 exercises that will help you a lot with that, or 4 massage techniques. So let's say this is the area where you had the A1 pulley released. You want to massage it like this. So this way, up and down, circle, reverse circle. Now, the trick here is the following. A lot of people forget, a lot of physicians forget that the area of inquiry, the area of that is problematic, is not simply at the incision. It's this entire area. Everything there gets very, very inflamed. So don't simply rub over that area, rub this entire area. So again, up and down, side to side, around, back around. And really, really hard. I mean, really, if you can, use your thumb to really get into this area really, really great. I mean, put some mustard behind this. I mean, really, really intensely. And if you do that, that area that feels really tight and thick from the scar, that should break down and lessen. Now, there's a trick here. When you have a scar from any type of surgery, if you're not able to massage that area, remember this. The less you do, the thicker the scar becomes. The more you do, the less tight the scar will be, and also the scar will be less thick. I want to repeat that. When you have surgery to the hand or any extremity where you can actually see the scar, if you massage the area, if you think about it, the scar tissue is coming up in all directions like this. The more you massage it on top, it just flattens out. If you don't do that, it will get very thick and very hard. Often people talk about keloids. Well, I look at a scar as basically a keloid under the skin. So you want to really just rub that area really well. So I hope that helps you, Inquisitive M. If not, let me know, and I'll show you some other techniques. I have a lot of techniques about that. But here you want to keep doing these exercises. Tabletop, up and down, around the world with the fingers, back around with the fingers. Fist here, up and down, thumb across, thumb back. All those exercises are basic exercises that will really help someone who's had a trigger finger release or a trigger thumb release. Same type of exercises apply. All right. The next one is from Shigatora, SHIGATORA. Shigetora. And the question is following. I was wondering what your opinion is on kinesio tape for treating minor wrist pain. Okay, so I like kinesio tape. However, the trick is this. Are you applying the tape properly? That's it. So I think our next video, I'll actually do a video that'll show proper application of kinesio tape, because so often people will come into my office and I've seen kinesio tape from people with circumferential wrapping around, which cutting off the blood supply to their fingers and hand. I've seen it around ankles that's really just horribly done. I've seen it on someone's back. We have a lot to talk about there. So I give you my word, the next video that I do, one of them will be about kinesio taping, the proper way to do that, and why you're doing it. So often people think, well, I'll just put the tape around the area that hurts me. Well, if you do that and don't do it properly, guess what? You may make a bad problem worse. Or you may not have a problem and just put tape on there and go from having no problem to a problem, because you may throw off the tendon excursion, or you may throw off where the blood vessels are in this area. There's so many things that can happen. So I will definitely do something about kinesio taping. But yes, I'm okay with some light kinesio taping if you have tendonitis, if you have a problem. Now, if you don't have a problem, you just want to be quote unquote cute. I want to put on tape and look nice. I want to have on a glowing tape. Well, there's no need for it. You know, my goal as a doctor is about function. It's about pain-free living and about giving you insights to prevent injury. So if you're just doing it to look cute, that's not the ticket. You want to use the tape when it's appropriate and necessary, and when you have an injury, so that you can prevent that injury from progressing to more severity. All right? So I really appreciate that. And again, that was from Shigetora, Shigetora. The next one. Oh, this is a very interesting handle. This is from Spa Z Reflex. That's SPA capital Z, then Reflex REFLEX. So, Dr. Levi, can you give me some therapy or stretches strengthening for my thumb? I have a ulnar ligament avulsion fracture and currently in a thumb spica cast. If you could please give me some tips on getting it back to normal after I get the cast off, that would be awesome. Okay, Spa Z Reflex, thanks a lot. I actually just did that surgery about 2 weeks ago on an athlete. So let's talk about that. So I just want to show everyone what we're talking about. This is the ulnar ligament here at the MCP joint of the thumb, right here. And it allows you to bend your thumb this way without over bending your thumb so that this doesn't touch here. When you have a complete tear of the ulnar ligament right in this area, you literally can take your thumb and bring it back here like this. Bend it all the way back. So when that's repaired, we put suture anchors there. Or sometimes we can primarily repair it if they don't have a Stenner's lesion. A Stenner's lesion is a complication that you can get from ulnar ligament tear. We'll talk about that one day too. So after we repair it, we put someone up like this in a thumb spica cast where the thumb stays in this direction. Now, so what are the exercises that I recommend afterwards? Well, there are a lot. The first that I recommend is, again, scar massage and desensitization at that area so that you don't get thick scar tissue here that can keloid in this area and can contract. If this keloid comes in this area, it can contract your first web space, and your thumb can be pulled over to your index finger. You may not be able to open your thumb really well like this. You want to be able to abduct. This is abduction. Abduct your thumb really well. So if you get a keloid here, it may pull your thumb in like this. You can't open this web space well. So that's important that you do scar massage and desensitization. The other thing, of course, is just overall strengthening of the hand. So again, flexion extension, in and out with the thumb, around the world with the thumb, back around the world with the thumb. And then you want to do some light weights where you're holding something like a 2, 3, or 5 pound weight. You let it roll down your fingers and back. Then use your thumb on the side to press like this. Those are exercises that will help you. Now, I also want to say, too, when it comes to healing from any type of surgery, the number one thing that I remind my patients are the following. Nutrition is imperative. It's imperative that you eat really well, don't smoke, don't drink, don't do any drugs. Those things will increase inflammation globally in your body, as well as minimize the healing that can occur at the site of surgery. So you really want to make sure you're taking a multivitamin, if that's approved by your doctor, that you're decreasing the amount of stress that you have in your life. People and things that stress you out after surgery, we know in general stress is not good for anyone. You know, it's sort of like essential hypertension. It's like the silent killer. So you really want to minimize stress in your life. But the other thing that's so important is nutrition and then going to therapy. Now, when the doctor, when he or she gets you into therapy, guess what? You have to show up. You have to go. If you don't go, then it's like, well, why would we even write the script? You know, so often I will talk to patients. Just even yesterday I had a patient. I asked her, well, how's therapy going? And her exact response to me was, well, what therapy? I said, well, the therapy that we talked about 3 weeks ago. I said, your hand is still sort of stiff. I said, I want you to have great excursion and be able to move better. You had carpal tunnel. You should be back by now. And she says, oh, well, I forgot to tell you. I decided not to go. I said, well, that doesn't work that way. You know, when we make a bargain here and we talk about what we're going to do as your strategy for your health, my job is to operate on you and to do that really well by the grace of God. Your job is to go to therapy and to get better and get your strength back and to decrease the thickness of the scar. So she and I had a great talk about that, and she's in therapy today. And I know she's in therapy because I called this morning, which is great. So I want to remind everyone that, you know, the relationship that you have with your doctor, it has to be one that's not only productive and authentic and honest, but it has to be one where there is open communication. You know, my patients, I love and appreciate them so much, but I want them to tell me when I've done something that they don't like or appreciate, because I will tell them when they do something that I don't like, that I don't appreciate. You have to have that kind of rapport with everyone, I think, whereby it's honest and authentic, and someone's not thinking they've said something that should be said. You know, I always say that, you know, there's a French say, débarrasser la table, which means to have everything cleaned off the table, have open communication, whereby no one's sort of thinking there's a gray zone about how you feel. You want to be open about that. So with my patients, I'm the same way. So I want to say this, with the ulnar ligament injury, the most important thing, it will be your nutrition, scar massage, and desensitization after you come out of the cast, and also to start physical therapy. And you can do this either with the physical therapist. My preference after ulnar ligament injury, and this is what I do in my practice, is to see a occupational therapist, an OT. And their specialty is really hand. Their specialty is hand and wrist, basically. So that's my recommendation. So I hope that helps you. The exercise, they'll show you everything from rounding your thumb and back, up and down, side to side. Those are the basic things. Then they'll show you how to do those with rubber bands and with the pulley, with the TheraBand. There's so many exercises that I can tell. I mean, it's infinite when it comes to getting the body healthy and fit again. But I'm sure you're going to do great. All right. And that, again, was from, I love this again, Spa Z Reflex. All right. The next one is from David Orton. That's D-A-V-I-D, last name O-R-T-O-N. Hey, Dr. Levi, last time you read my question concerning my problems related to epicondylitis and wrist tendonitis. I would love to clear my doubts regarding my problem. I have wrist tendonitis, epicondylitis, and weakness in the wrist, but also small wrists. Would you prefer that I recover from this condition one by one, or is there any way to recover from them all at once? I'm also training to get stronger wrists. Should I recover first and then train, or should I just train while recovering? I have one last question. And again, it's from David Orton. I have one last question. When I grip objects, be it heavy or light, the palmaris longus seems to expand with an unusual size. Do I need to worry about that? Okay, so David, great question again, and glad to interact with you again. So let's talk about this. If you have epicondylitis and tendonitis, so lateral epicondylitis, everyone, this is tendonitis here at the wrist. The most common tendon involved with that is the ECRB tendon, extensor carpi radialis brevis tendon. Now, there are two tendons there, really, is ECRB and ECRL, extensor carpi radialis longus tendon. But the one that causes the problem more often, of course, is the ECRB tendon. Now, for that, you want to do what I've talked about before here on the show, inertial exercises. That's spelled N-I-R-S-C-H-L, inertial exercise. And let me just show you briefly how they're done. Again, the elbow is straight, the hand is in front, and you hold the wrist, you flex the wrist back this way, and you hold this for 30 seconds so this can straighten out here. 30 seconds, so you can really stretch that out. Then you put your hand back this way, and you grab your fingers and your hand, and you hold back. You pulling back, so you're extending the wrist back this way. and keep the elbow straight, and you hold that for 30 seconds. Now, I also recommend that when you're doing this, that you do it sitting down and not standing up in case you start having pain or you feel lightheaded. Anything can happen. So stretches like that are best done when seated. Now, for your wrist tendonitis, the wrist tendonitis, what's not clear in your question, David, is do you have tendonitis of the extensors of your wrist or the flexors of your wrist? I'm assuming because you talk about the palmaris longus, which is the palmaris longus is if you bring your hands like this, the palmaris longus tendon is this tendon right here. So, and you talked about that. So I'm gonna assume here, David, and if it's the wrong assumption, you let me know, and I'll make a correction about it. That you're talking about your flexor tendons. The flexor tendons are here, and they allow you to flex your fingers and wrist this way. So, if you're having wrist tendonitis, again, I recommend you do these stretches. Take a look. Where again, you bring your wrist up like this and hold and down, around the world, back around the world. I also recommend that you take frequent stretches when gaming. Now, frequent for you will be different, David. Instead of 5 minutes every hour, I recommend taking a 5-minute stretch break every 30 minutes to sort of minimize the amount of inflammation and pain that you're having in this area. Make sure that you're also staying as fit as possible, that you're watching your diet. All these things matter. Make sure that your keyboard, your mouse, your monitor, that everything is ergonomically balanced the best that you can. Now, and don't forget, I know if you're a student, for example, how expensive it is to get a monitor and keyboard and the proper mouse. I get it. Trust me, I've been there. I've lived it. I totally get it. However, whatever you do have, do your best to make it as ergonomically balanced as possible. All right? I hope that helps you, David. But the other question that you asked is, should you try to do one at a time? So no, you do all the stretches for everything. You want to do the stretches for your elbow as well as for your wrist. The goal here is to get your body feeling better as soon as possible. So you don't have to compartmentalize it, saying that, well, I'll only do things for my wrist today, only for my elbow tomorrow, or I'll only do things for my elbow for the next few weeks, and then when this is better, I'll do something for my wrist. Absolutely not. No, you want to be aggressive about therapy now. And the other thing I want to share with you also, David, is acupuncture. If you have access to a really great acupuncturist in your community, I highly recommend acupuncture. I love it. I love it for stress. I love it for pain. I love it for inflammation, for decreasing smoking, for weight gain. I mean, I think acupuncture is really just a phenomenal way of healing. You know, it's sort of like chiropractic care. So many people, especially for myself as a physician, when I talk about sending people to a chiropractic physician, you know, a lot of my colleagues really give me a lot of grief about that. But of course, I don't care. You know, my goal is to do what's best for the patient. And my goal is to be of service to the patient and to my community. So I think chiropractic care as well as acupuncture has a really high place in medicine and in medical care, but many people will not go. So I recommend, David, that you definitely go to an acupuncturist. You're going to be surprised at how much help this will give you. I really mean that. And then let me know. I want to hear about it, David. Let me know. All right, the next question, and thank you for the question, David Orton. And the next question is from Kasit, and that's spelled Kasit. And the question is, would you consider doing some tutorials on joint-friendly workouts? So, yes, I'll do that. So let me tell you, so our next workouts, I'll talk about kinesiotaping, and I'll talk about joint-friendly workouts. Now, I want to say in general, all the workouts that I show are joint-friendly, meaning that if you execute them properly, you minimize the stress on your joints. The goal here is the following. You know, everything that we do for our videos and everything that we produce, it's really about giving you the best in quality and about giving you things that are safe, effective, practical, doable, and preventive. Things that will help you to not get injured and also to help you not only maintain a certain level of fitness, but also to elevate your level of fitness. You don't want to just stay here on that plane. I want you to march forward. The goal with fitness is, as we talked about here, you want to take small, sustainable steps to have long-term, maintained goals. But you got to do something every day. Every day, again, I've used this analogy before about going to the gym and only doing the Stairmaster or the treadmill. You want to sometime go and do the rowing machine. You want to change the speed on the rowing machine, change the speed on the Stairmaster, do the stair climber sometime, do the treadmill other days, do the recumbent bike sometimes. There's so many things you can do. The goal here with fitness is diversity. The more you diversify your workout, your body appreciates that. I had a great workout this morning, actually, at the Phoenix Effect here in Los Angeles on Melrose. Great teacher there, C.J. Benton. It was a phenomenal class. It was tough, though, but it was really wonderful because everything we did in the class was very diverse, very different, very hard, and technically very difficult, but it was a great, great workout. It really was. So I want to remind you, Cassette, yes, I will do one on joint-friendly workouts, but in general, all the workouts that we do are joint-friendly, all right? That's from Cassette, K-A-S-I-T. The next one is from, wow, this is a long one. Say a lot of different things here. So this is from Lord Darkside Loves Harley Quinn Forever. So Darkseid is one of the nemesis of Superman, of course, and Harley Quinn, as we know, was in Suicide Squad. She's the Joker's girlfriend, schizophrenic basically, who is a fighter. So let's talk about this. So Lord Darkseid loves Harley Quinn forever. So the question is, hey, Doc, I'm 25. I've been gaming since I was 6. I've been doing your hand exercise because my wrists get sore. They really help so far. I will keep it up. Thanks a lot. Okay, well, Lord Darkseid, thanks a lot. Excuse me. Lord Darkseid loves Harley Quinn forever. Thanks a lot. I'm glad the exercises are helping you. Our goal, again, is to do what we can to really be an effective force of change in the gaming community and to really let people understand and know that gamers and esports players, that you guys are athletes. And my goal is to do what I can to garner more respect in the community, to make sure that other physicians understand that I do take care of esports athletes and gamers, and yes, they are athletes. That's the bottom line. So again, Lord Darkseid loves Harley Quinn forever. Thank you for the comment. So the next one is from Danny E. It's really nice to see that you actually get out to meet gamers. You're an awesome doctor. Well, Danny E., thank you very much. Grateful to be of service. I appreciate the comment. And thanks for joining us on Twitch and YouTube. Now, the next one, these are sort of long, but I want to get through them. This is from Facebook. And there's no handle with this. It's simply, hi, Dr. Levi, I just read an article posted by yourself, 7 exercises to maximize hand, wrist, and forearm strength. This catches my eye because my wrists are weak. I really struggle with push-ups, getting pain really quickly in both wrists. So with the help of Google, I found your article and going to adapt this to my workouts. A little about me is that I can concentrate more on my legs because in my left knee, I have PVNS. Now, PVNS stands for pigmented villonodular synovitis, all right? And continues to say, having had 4 surgeries by keyhole in past 7 years. In my right knee, I have grade 3 osteoarthritis. I played the helpless soul for a while, but didn't suit me so far. So I worked for a diploma in personal training. I want to head towards helping people in rehabilitation from injuries or surgeries. Anyway, I'm always looking for more knowledge and finding your articles. I have to say, I found it really eye-opening and so glad that you took the time to write it. I appreciate that you're a really busy guy, so don't really expect a response. I just wanted to let you know that your advice reached a guy in Scotland, and he has took it on board. I'll send you a message in a few weeks to let you know how it works out. Well, to Scotland, big shout out to Scotland. So I want to say this. I appreciate your comment. Yes, use the stretches and the strengthening exercise. I think they'll help you a lot. So thanks a lot. And the last one is, hey, Dr. Levi, you seem to like gamers, so I thought you would give this a try. Basically, I have an issue with being sleepy every day and lazy. I play 12 hours a day to be a professional gamer, but lately I've been slacking a lot, losing aim. I play Overwatch, and I'm really overweight now. I weighed at 116 kilograms, so I'm obese. I'm 20 years old. I really want to continue my path on becoming a pro, but I want to get rid of this laziness and sleep deprivation, and also lately I've been getting angry easily because of not progressing anymore in my game. Do you have any suggestions or tips? Yes. Number 1, I recommend that you start meditating every day. 2, be careful with your diet. 3, stay as fit as you can. And 4, make a list of your long-term and short-term goals so you can stop the laziness, because lazy means that you don't want to embrace the greatness that you already have. All right. So I want to thank everyone for listening today. It's Dr. Levi. I look forward to having you join us on Twitch TV. Thanks for subscribing and following us and liking us on all our social media platforms. I want to thank Tony Sweet as our engineer today, and the great Janet Rodriguez. Couldn't do the show without these great people. It's Dr. Levi. Have a great, great week. And remember, you are worthy and life is for you. Game on. Bye.